Okay, let's go to London and speak to Dr. Omar Abdel-Mannan. He's a British Egyptian Paediatric Neurologist. If you've been watching TRT World since October the 7th, you'll know that the doctor is also the co-founder of Health Workers for Palestine. He worked and taught in Gaza's hospitals for 10 years. Doctor, thank you so much indeed for your time. If you don't mind, I just want to read you a couple of quotes. The first, we heard from Sean Casey in our report from the World Health Organization. He went to al-Shifa hospital. He spent weeks in Gaza. He's just left. At al-Shifa, he says, literally 5 or 6 doctors or nurses are seeing hundreds of patients every day. At Al-Ali Hospital in Gaza City as well, the situation, he says, dire. He says, I saw patients who were lying on church pews, basically waiting to die in a hospital. They had no fuel, no power, no water, very little in the way of medical supplies, and only a handful of staff remaining. And presumably, that's what you're hearing every day from your former colleagues.
Absolutely. Thank you so much for having me on the program. So my colleagues, actually, British colleagues, have just come out of Gaza on that WHO EMT mission with medical aid to Palestinians. And Professor Nick Maynard and his team have been telling us these very same stories. They were working for 2 weeks at Al-Aqsa Hospital, which towards the end was targeted to the point that they were denied entry on the last day to be able to treat patients. On a typical night shift in one of those hospitals, they would have 500 to 600 admissions with severely injured children, women, and men from Israeli air raids. They would have at most 3 or 4 doctors working on the shop floor in the emergency department. The triage system had collapsed. There was no way to triage anyone. Nick described to me, Professor Maynard described to me how he found a child by chance lying in the middle of the floor. This child was groaning, and what he could see was the child had a clear head injury. But what was much more concerning was he was lying unattended with an open chest wound with air sucking in and out, which would lead to a pneumothorax and, likely death imminently. This child was picked up by Nick and his colleague, Dr. Smith. He was taken to the nearby resuscitation area. There was no space, so they put him on the floor, resuscitated him, and saved his life. But this is what happens when you destroy a healthcare infrastructure and system for 102 or 103 days unabated, when you attack hospitals, when you kill health workers, when you deprive them of food, of basic nutrition. This is 100% man-made, and this is blood on the hands of the Israeli occupation forces. This is blood on the hands of the Western governments that have allowed this to continue. This is blood on the hands of the mainstream media that have been continuing to warmonger and allow these genocidal tactics to carry on unabated in 2024.
Dr. Seema Jilani was another member of that mission there, the medical aid for Palestinians. And she has worked in conflict zones like Afghanistan, Iraq, and Lebanon. She says in her experience of working in conflict zones around the world, she says this is the most extreme situation I've seen in terms of scale, severity of injuries, number of children that have suffered. They have nothing to do with any of this. The problem is, Doctor, if the WHO and other various UN organizations can't get the Israelis to agree to allow injured Palestinians to leave Gaza, then nobody's going to get them out.
So the current issue with people leaving Gaza is obviously difficult. We have at least 4,000 or 5,000 children on a waiting list who are waiting injured to get out for complex treatment and to have that, whether it's in the neighboring countries or even in Europe. We've been working on these projects. Now, the issue is that, as you said, the WHO, the UN, Amnesty, Save the Children, every reputable, respectable charity and NGO organization and leading voice in world peace has come out and said what is happening is essentially a war on children. It's actually not a war on children, it's a genocide of children and people. So this continues unabated. Now our governments, and this is directed at the UK government, Mr. Rishi Sunak, the US President, Mr. Biden, others are unable to act because they are impotent and they are too vested in their interests with the Israeli government. If that is the case, and that has continued to be the case, it is now the responsibility and the duty of every citizen, concerned citizen of this world, to start speaking up. The Israeli government has lost the hearts and minds of pretty much everyone in the world, apart from these warmongering elites. And it is now the duty of doctors, healthcare professionals, non-healthcare professionals, your average Joe on the street, to get up, speak up, go to protests, go to sit-ins, stand at soft pickets, start taking some action, and most importantly, to boycott the Israeli state that is funding these arms that go directly to Israel. We have seen the NHS, our very own NHS, striking a deal worth $300 million with the spy software company, Palantir, who are essentially directly involved in arming Israel and allowing cybersecurity and intelligence to continue. This is unacceptable. Not in our name do we allow that to happen as healthcare workers who are there to protect humanity. The NHS is funded upon the principles of looking after people and treating them and saving them, and yet they are essentially giving money to warmongers and genocidal psychopaths.
Do you think possibly the spread of disease is being underreported simply because people aren't able even to get to a facility to say that they're suffering from whatever it may be? We've got at least probably a couple more months of extremely cold weather and hundreds of thousands of people sleeping in the streets, open sewage running through some streets of some cities across Gaza.
Look, the reality is these reports of 24,000 killed by the Ministry of Health are a whole underestimate of what is happening. I was speaking recently to WHO representatives who mentioned about the numbers of infectious diseases spreading. They are estimating tens of thousands of upper respiratory tract infections, thousands of cases of hepatitis, of diarrheal waterborne illnesses, which may well be cholera. Within that, you will have a subsection of that society, of those unwell children, unwell adults, die. That is in a good healthcare system, let alone one that is not functioning. So, the reports of 24,000 are a gross underestimate. I suspect, based on just quick calculations, that we are talking about at least 50,000 people that have died. And many of them have died after they've been operated on from sepsis, from infections, women who have given birth in unsanitary and unsafe conditions and have then resulted in getting infections that have then led to their death because of the lack of antibiotics, the lack of cleaning water, the lack of any basic forms of medical care. We have hospitals that are completely disabled. There is only a handful of functioning hospitals currently. Even those functioning hospitals are dysfunctional. And the Israeli government, the Israeli occupation forces has been able to create a situation where people are unable to access healthcare, they are unable to access food, water, basic supplies, and they are being treated like human animals, just as what was said just after the 7th of October. It was not used to describe Hamas. It was used to describe human beings, Palestinians. They are brothers and sisters. They are human beings. They are no less worthy than an Israeli, an American, an Englishman. They are as worthy, if not more worthy than us, because they are the best of humanity.
Dr. Omar Abdel-Mannan, thanks once again. Very much appreciated.